I'm going to talk about from IPASS to IFUTURE. IPASS probably is one of the significant studies that bring in the EGF mutation as a biomarker selected population for management of lung cancer. So I just talk about the history, how we get there, in a way from not knowing to knowing, and from knowing how do we design clinical trial to prove that is what we should do in the future. So I think that experience is actually tremendous. Is in a way is that when we first designed IPASS, that shortly after the discovery of EGF mutation, which was 2004. So by knowing about this mutation, but at that time we didn't have the technology to select the patient prospectively. So we can only use the enriched population of non-smoker, adenocarcinoma, and mostly Asian, and then retrospectively use the biomarker to confirm the role of EGF mutation in selection of the patient for the TKI. So that was the IPASS part. But then for the IFUTURE, actually is quite bright. Based on this experience of how we develop this knowledge, there's so many new platforms that we can actually engage the future patient to be on. Now I start off with talking about prevention. Charlie Swanton from UK actually had done excellent work on the role between pollution and non-smoker lung cancer. The data actually give us a lot of hope how we may actually prevent lung cancer in the future. And also, would that lead to the potential of CT scan screening for non-smoker for lung cancer? Following that, on the intervention part, apart from ADC, antibody drug conjugate, I'm going to talk about cancer vaccine, cellular therapy, POTAC, as well as the potential of how we can use this technology to actually in the earlier stage of disease. So I think there's actually a lot of hope that we can improve the outcome of the patient with lung cancer.